call in. I know you guys have probably been affected, whether it's personally or somebody in your family, in your immediate community. So this is a great opportunity. Just kind of talk about the issues that are affecting our community and just people all over the world for that matter. So Rashad Mills Show. And also, wouldn't you know, Dr. Shepard has on a bow tie. You can't beat that.
That's right.
Welcome to another edition of the Rashad Mills Show, courtesy of PowerOfPurposeRadio.com. Every Tuesday night, you guys have decided to join me at 8 p.m., and without you guys, this show would not be possible. I'm forever grateful and thankful for your presence. Facebook Live community, I thank you for tuning in as well. I am fortunate to have Dr. Jonathan Shepard join me on the show. Thank you so much for joining me on the show. Now, Dr. Shepard, I'll be quite honest with you. I went through your resume, and that could actually take a month of Sundays for us to talk about, but just to keep it kind of short and sweet, you are the Chief Medical Officer for Hope Health Systems, which is a large outpatient facility here in Baltimore, Maryland that treats thousands of people. In addition to that, in 2014, you were named the president of the board of directors for the Black Mental Health Alliance, which is a nonprofit organization that's really dedicated and focused on consultation and helping minorities with mental health issues. Of course, you're a certified child and adolescent and adult psychiatrist. So with that extensive resume that you have, I really wanted to start about you being the president of the board of directors, especially as it relates to African Americans, particularly in the mental health issues that affect us in our own communities. And my first question would be, even with the advancement in maybe the last 5 or 10, maybe even 15, 20 years, with all the knowledge, and it's certainly a much bigger focus on mental health issues in our community, from your experience, do you feel that it's still a stigma associated with that in the community? And if so, why?
To answer your question, yes, there still is a stigma. The stigma is real. It is one that is prevailing through our communities. It is one that I struggle with on a daily basis as I try to treat and consult with those persons in our communities about mental health. Why is it? Because of the different atrocities that we have suffered as black people. Here in Baltimore, if you just go back and look at the history of Baltimore, when I first moved here 8 years ago, that's one of the first things I did, try to understand the people where I was going to be working and treating, and who I was going to be treating. Here in Baltimore, you had institutions, hospitals that were literally taking people from the street and injecting them with different viruses and diseases, and making them sick. So people came to mistrust the field of medicine, especially when it came to those who were dealing with mental health. Because when you're dealing with people who have mental health issues, it's something that you cannot see. It's something that is not on the outside. Like if someone has, for instance, a broken arm or something like that, you can see it. Or even if someone is having a seizure, something that has a physical manifestation, you cannot see it. So to answer your question, number one, because of the mistrust between the black people and really people as a whole and the field of medicine, and then because mental health is something that you cannot see, so it's something that you cannot see, people don't believe that it is real. Then thirdly, within the black community, we are people of faith. Typically, we're people of faith.
That's a great point.
And then, as being as people of faith, we also tend to take everything to God, which we should. I'm a man of faith. But when it comes to our health, we say just pray it away instead of actually going to consult and get out and seek out, I should say, the treatment that is really needed. So those three things I'll just start with will continue to perpetuate the stigma that is out there. And it's real, man.
Dr. Shepard, you must have been reading my notes, because that was one of the things that I was really going to touch upon. I'm glad that you transitioned to it. Since we are a people of faith, and it's often said, just take it to the Lord in prayer, how often do you think, and I don't know if we can put a particular percentage on this, but how often do we as people of color ignore significant mental health issues because, again, we want to pray it away. We can take it to the Lord throughout the week and pray, and certainly go to church on Sunday. How often do you think those mental health issues are ignored because of our faith?
They're often ignored. I hate to put a percentage to it, but I would say greater than 80%.
Wow, that's
be
staggering.
honest.
That's a staggering number.
Greater than 80%. And I talk with pastors. I talk with my own pastor, Pastor Pierce, here at Carter Memorial. And I tell him, I don't see sometimes how he's even able to deal with it, because many people who come to the house of worship, whether it's a cathedral, whatever, they come because many of them are in dire straits and their minds are not right. And there's something that is going on that is causing them to not be able to function properly. So when people are attending church, when people are going to places of worship, one of the things that I understand is people go there to receive help. And one of the things that I see is that when people go to receive help, many of them are not looking for a handout. Many of them are not necessarily looking for money. Many are looking for peace of mind. Peace of mind because of the trauma that they have occurred. Someone just did something to them that they should not have done. Family issues, all that type of stuff. They're overwhelmed, probably maybe by the financial issues. So all these things are happening within a house of worship, and then you're hearing the man of God, the woman of God, whoever your minister or pastor is, saying, well, just pray it away, and God will fix it, everything will be okay. Lift your hands up and you'll be delivered. And I wish it was that easy sometimes. I really wish, that I could just say, it's all over. But then when they leave right out the side of the house of worship, all that stuff floods them back again. Right. And the
reality soon sets in again.
Exactly.
So you, as an African-American male, how are you able to sort of gain people's trust, especially within your own community? Because as you previously mentioned, there is this stigma, and it's an issue of trust. So when you speak with people, how difficult for that on your end is it to gain that initial rapport and allow people to trust you enough by having them tell you their concerns? How difficult is that? Because I'd imagine it's pretty difficult.
Well, trust has to be earned, and it is very difficult. So that's one of the reasons why people go to their minister or pastor, whoever it is, first, because they trust them. And they will not go to a mental health clinician such as yourself or myself because they feel like they can tell this person something. But if that minister is not trained, then they will back away. How do I now, because me being a minister myself and being a physician, I'm put in a precarious situation because many times they're at odds.
Right.
The people of faith will say, well, just pray it away. In my profession, I understand that, no, that's not just going to work because this person has a true disorder and needs to be on medication or needs to have some type of intervention to get this person straight. So how do I gain that rapport? How do I gain that trust? I listen. People want to be listened to, not talked to, not told what to do. People want to be heard. And I think that's one of the reasons, again, why people even go to a house of worship, because they can just kind of sit back and listen, but they'll go to their pastor and they know that person will just listen. But if they can't go to that person, they'll find somebody. They'll go to their good girlfriend. They'll go to their guy, their male friend or whatever, and just want somebody to listen to. So how do I gain the rapport? Number one, listen. Let them know I acknowledge that I'm hearing what you're saying. Even when people come to me in my office and say, I don't believe in any of this, I don't know why I'm here, but I'm just here because I've tried everything. And if I just sit back and listen and say, okay, I've heard what you have to say, many times they will find themselves opening themselves up to a point to where, wow, now you can give that advice, now you can give that instruction, and hopefully that guidance that they need to hopefully move them in the right direction of some type of mental health healing.
I think you made a very critical point for people that are watching powerpurposeradio.com, Facebook Live as well. I think listening is such a critical element because some people just want to actually have things, they want to get it off their chest. It's really, right, for lack of a better term, it is therapeutic just right, to release things and have that listening ear. Now, I want to ask you this question. People will often talk about medication. And I know, regardless of the community, certainly in the African-American community, it's a great dilemma that exists to take medication or not to take medication. For some of the mental health issues that exist, when would you say, from your professional experience, now is the time to take medication as opposed to it's not. So for instance, here's a scenario. You have someone, they believe that they are depressed. When is it the time to say, maybe you should seek some kind of medication that can help you with this particular issue? Or is this just, quote unquote, a moment or a period of your life that you're going through?
Right. So it's something that I call distress versus disorder. So distress is when a person is going through that momentary crisis that you're talking about.
Okay.
And so as a clinician, as a professional who is trained, we have to be able to decipher whether a person is going through a distress versus a disorder. So to answer your question directly now, medication is given when a person is in a state of disorder, not in a state of distress. And there's nothing wrong with being in a state of distress. We all go through it.
Absolutely.
We all have bad days. We all have days where we don't feel like getting out of bed, or even when it seems like the world is about to, just crush us to death.
Absolutely.
But there's something wrong if you're like that for 2 straight weeks. That's when you know that there's a disorder. When there is, quickly you just say the inability to function. Disorder is defined as the inability to function properly or normally in your setting or environment. So for adults, that would be you're not going to work. You're not able to be that person within your family or whatever person in your community. For children, he or she can't go to school. So they're not operating to be able to go to school, function again in their community. And so when that is going on, then that's when medication needs to be considered. Think of it like this. When a person has a disorder in their liver or a disorder in their pancreas, it's called diabetes. A disorder in the liver, maybe hepatitis or something else. That's when medication is considered. We have a disorder in the heart. We're looking at to see is it high blood pressure, is it some type of heart disease? Then that's when the doctor is giving the medication. When we have a disorder in the brain, that's when we have our mental health issues. That's when we're having things that we, again, can't even decipher, even understand, because we don't even understand how the brain operates.
Wow. Okay.
But the medication will help regulate and hopefully bring that disorder to a point to where now you can receive proper treatment.
Now, we've gotten to this point that, an individual may consider medication because they have experience in a disorder. It's something outside of the norm. They can't function within the normal realm in which they would. What do you advise a person about as it relates to medication, how long they're going to be on it? Because I've talked to patients, of course, you have throughout your years providing the service to the community, which you have. That's the number one concern. How long do I have to be on it? How is it going to affect me? Is this something that I have to spend the rest of my life? So how do you overcome these barriers? Because there's so many barriers to overcome to get people to consider medication and then certainly to take it and follow through with it until, they're at the point of being successful and they no longer need that.
Right. So once you've identified that there is a disorder, then we need to talk about what type of medication is appropriate for that particular case. So that's my job to be able to tell them these are some of your options. It's my job to be thorough as far as side effects, risk, and benefits. Here's the problem that's happening within our black community, and really the community as a large. People are seeking mental health treatment from people who are not qualified. They're going to their primary care physicians. They're taking their children to the pediatricians. I'll get the word out. To various other people who are not qualified to be able to handle the mental health issues. Wow. And so one of the things that we have found is that these people, they're trying their best because they want to be able to meet the need of the parents or meet the need of the person coming in, but they're now giving us a bad name, giving the wrong prescription, giving the wrong medication, don't really know how it operates. So it's giving psychiatrists a bad name because when they hear these medications, they're like, oh, I already tried that because so-and-so doctor put me on this. So that's one of the things I have to do is be able to listen, hear, because most times when they're coming to you regarding medication, either they've already had that conversation in their head, had it with someone else, or even with another physician. So you have to be able to hear them again. Listening again is very key. So you can be able to address what the issue is, address how you're going to be able to start that medication with them. And then lastly is I tell people is that if we're going to start a medication, that we need to talk about staying on the medication consistently for at least 1 year. So that's where I leave that conversation off.
Why 1 year? I'm curious.
Because most times it took at least a year to get to where you are at.
Okay.
for that disorder.
That's a great response, Dr.
So
Shepard.
that's why. And then also I tell people, if you listen to the doctor and actually took your medication like you're supposed to, you put us out of business. But most people can't even last a year.
Really inconsistent as it relates to taking that medication.
Exactly.
I want to take a few steps backwards and go back, because we talked about children and adolescents and things of that nature. One of the things that I'm certainly, the people watching powerpurposeradio.com and Facebook as well, I'm sure that you can educate them in a way to understand, because I hear this conversation quite a bit. Why are so many African American males, particularly in elementary schools, diagnosed as being ADHD? And it's been, quite a debate. I've heard things similar to, African American males at that age. They are very active. They're energetic. I even heard about a young man that was probably misdiagnosed because he was overly active, fourth grader. He talked with his hands a lot. And his mother said, look, he's a black boy. And we as African American people, we are very expressive as it relates.
Yes.
Right. So just kind of jump into that, because I know a lot of people watching, they have sons and things of that nature. And they want more information on that, because that's a topic that I hear all the time.
Yeah, and it's one that I tell people too, and some of this is a little bit even controversial, because when I studied the stats in regards to the number of black people who are on medication for ADHD, it is still in a smaller percentage in comparison to the white counterparts.
Wow.
And so a lot of people want to argue with me, oh, Dr. Shepard, you're wrong. But I say, well, let's go look at the literature. When you look at the literature, it really is, and we already identified why that is, because of stigma. We don't take our children to the psychiatrist. So what happens is there's a bad rap, because those children who are labeled as the problem children, many of them who are in foster care or in some type of other DSS custody, those children start to get overly medicated. They're dumped on. So we hear about those things, and so they're magnified to make people think that all black boys are, on medication, or all black boys have ADHD. And I know that's not what you said, but that's one of the things I kind of have to sort through and help people, to understand that when you look at the stats, we are still in a smaller percentage in relation to those children who are white counterparts as far as medication. Now, why? Again, do you have black boys who are considered or labeled ADHD and they're not? I do see that, so I do agree with you on that. Again, it's because people are not culturally competent to understand what a black child or what a black family goes through on a day-to-day basis. You'd be amazed. I just got a call last week again for a company, I won't put their name out there, to come and do cultural competency training for their clinicians, because they understand that there is a difference in between how people are raising their children. And you need to be able to understand and appreciate that difference. I'll never forget when I was in residency, there was a black woman, she was put on an antipsychotic because she said that she heard the Lord speaking to her.
Wow.
The person did not understand it. They were of a different race, different culture, and they said, oh, she's crazy. So they actually put her on an antipsychotic. When she came to me, I understood what she was saying. I knew what she was saying. And we stopped the medication, and she was fine.
Wow. I mean, that had to be quite a dilemma for you, being a psychiatrist as well as a minister, man. That was just like, it put you in a very, I would imagine, in a very difficult situation. So with all the stresses that, African Americans face, and other minorities, whether it's financial, whether it's community-based, the crime, and, PTSD, and a variety of different factors that we are unfortunately affected by on a daily basis, some of us, depending on where you live at.
Right.
We can't change those factors.
Right.
But how can we strengthen ourselves mentally? Because a lot of people, just like we talked about physically, physically, obviously, if you have a physical ailment, you can see that. That mental health ailment, you can't see that.
Right.
So how can people strengthen themselves from a mental health perspective, or is that even possible?
That's a very good question, and that's what we need to do, because trauma is real within our community.
Absolutely.
And we also need to know that everybody is not affected the same way by trauma. And we also have to appreciate that children are very resilient. We have to give children more credit than what they are given in our communities. Our children can bounce back from things, but what they need to do is see consistency. We need to be consistent in how we are going to raise our children, be consistent in what we're going to do, be consistent in our routines. If you're a person of faith, prayer, attending worship services. If you're a person who meditates, continue to meditate. Let your children see that. Exercise. Exercise is a great way to relieve stress. So you have to be in tune with your body to know what it is that helps you to build up your mind. When I go home from work, I do at least work as possible. I try not to think about Hope Health System.
Leave it at the office.
I leave it at the office. And folks are they don't do their work at their jobs, so they bring it at home with them, and this and that. And again, I'm not talking about anybody, but it's just we have to learn how to be able to separate what we do, because so many of us carry so many different responsibilities. And I get that. I really do get that. But we have to learn how to be able to separate and be able to free up our minds when we transition. And that's one of the reasons why our children struggle, because they see how we carry so much stuff. So they learn to carry that stuff. And it really does backfire on us.
How important is the media as it relates to your response says it all, but how important is the media as it relates to mental health?
Yes.
How important is that? What's your take on that?
Well, media can be your friend or your foe. Recently in the media, you have started to see more people going to have a individual therapist. So you've heard about that. So in that realm, the media is definitely helping us. Where the media is fighting us is that they don't take it all the way to, well, you can just go to this person for this, you can go to this person for that or whatnot. It's, a quick fix, so to speak. That's kind of the society that we live in. We want a quick fix. I'll go get my 5 sessions and I'm done with it. And it may take more than that. So that's where we really fight each other. Let's think about the celebrities who go into these substance abuse rehabs. I'll be wondering, what are they doing in there? It's like, everybody got to go to rehab. But what are you doing in rehab? And so I get
making
the fact,
a new reality show.
Exactly.
Right.
Exactly.
Right. It's a new reality show.
Right. So so that's where it can help you, but then also it can fight against what we're trying to do.
I swear you're looking at my notes. One of the questions is we're moving. We still have some time left in the show, but we're moving toward the end of the show, and I just wanted to put you on the spot, and in a good way, what I call rapid fire. So I have all my guests. I'll throw out a topic that's relevant to what we're discussing mental health issues, and you mentioned celebrities.
Okay.
So I am going to give you 3 celebrities. If they walked into your office, all things considered, obviously they have the financial background to pay you whatever you're asking for, and I'm assuming you may actually jack up the price for them because they're celebrities. So now the hourly rate may increase a bit. How would you begin to diagnose them, and what medication, if any, would you refer? Are you ready?
All right.
So I'm going to give you 3 celebrities. The first one is the 45th President Donald Trump. How would you diagnose him, and what medication, if any, would you refer?
Our president, I was going to say the guy, so I'm sorry, I have to be very respectful. Our president has a personality disorder. I am sure of that. Narcissism is in there. He does not deal in reality. Honestly, I don't think there's a medication for him. This dude is just on something that doesn't even make sense to me. How he handles business. And the scary thing about him, and I know you're going to move to the second one, is that he can get away with some of this stuff.
So how would you gear your individual sessions for him?
Well, I would...
A lot of prayer. That's one that you may need to talk to the Lord about.
Yeah, because,
Father God.
Right. Because I'm telling you, personality disorders, they are the hardest to treat.
Wow.
Yeah, some people say there's no help for them.
Wow. So I'm going to go with my next celebrity. This could be a couple's issue. You could see them as a couple. For the sake of the show, I want to break it up. Kanye West.
Lord. Man. Yeah, he another one I think has a personality disorder. You know, I was working with a guy recently who's a marketing consultant, and he was just telling me how celebrities, he's like, just behind the scenes, like most of them got mental health disorders. Most of them need your help, doc. I was like,
That's
really?
opened up a new market for
Yeah,
you.
yeah. Hey, you know,
Dr. Shepard, the celebrity psychiatrist.
Hey, man, hey, right. I hear that.
So for Kanye West, it sounds like he's sort of grouped in with Donald Trump, maybe.
Yeah.
And I thought he was actually diagnosed as bipolar.
I do believe I heard that. You know, and I'll be honest with you, a lot of people who are within that creative arts sphere, atmosphere, they do have a lot of those manic-like symptoms.
Absolutely.
Where they tend to do a lot of things, take a lot of risky behaviors, staying up all night, you know, have those increased pleasurable activities, things like that. So, you know, I can't fully diagnose him, you know, without doing an assessment, but he definitely has a lot of those characteristics. So,
Right. Before I get to the last one, Dr. Shepard, just want to interact with some people. Facebook Live, Candy said it's like some mind control that Trump can get away with such, I think I can say the word, asinine and unbelievable crap. Okay.
Right.
Tamika
That's
said,
true.
Jesus, laugh out loud as it relates to Donald Trump. So, yeah, Tamika, definitely we need to pray. And also, big shout out to Dr. Ron Brown, one of our colleagues. He's
Yes,
actually
sir.
watching Facebook Live as well. So the last celebrity, certainly last but not least, Kim Kardashian.
Yeah. Kill's got some issues. You know, I was really feeling sorry for her. I still feel sorry for her regarding the robbery that happened in Paris.
Potential PTSD.
Potential PTSD. And how she's responding to that, though, is troubling me. I know everybody handles their trauma very differently, but if she's putting out a show that I'm hearing now that's going to recap some of this stuff, they need to be aware that she could be traumatized again.
Wow.
You know,
That's a great point.
I mean, it happens so frequently. You know, you could just be walking, and part of PTSD is having these flashbacks. And even if they're trying to retrace some of the steps and things like that, if she truly was traumatized, they need to be very careful. I've done workshops where I've talked about PTSD, and literally I've seen people change within my workshop.
Wow.
And literally go back to an area where they first were traumatized. So, you know, there's nothing to play with. So, you know, does she have anxiety issues? Does she have PTSD? Does she also have bipolar? I don't know, you know, but I tell you, when you look at these reality shows, I just be like, man, right for the picking.
So it seems like for all three of our celebrity friends and maybe the next potential clients for you, Dr. Shepard, we need to really pray for them. Just have a moment of prayer. So we are at the end of the show, but before we go, Dr. Shepard, you have a wealth of experience, obviously working with people on an individual basis and speaking with people as well. So for the people that are watching powerofpurposeradio.com and Facebook Live, if they need you to potentially speak, you know, and just enlighten people and educate them more about your experiences and some of the things that are going on in our communities from a mental health perspective, how would they be able to get in contact with you?
So you can reach me over at Hope Health Systems. The phone number there is 410-265-8737. I also give out my email address. That is jshep, JSHEP, 2471 @gmail.com. And reach out to me. I'll be happy to do my best to help you, assist you. If you know someone who is in need of mental health services, you've heard me talking, you heard Brother Rashad talking, and you know that this person really needs a person for mental health treatment. Call that number, 410-265-8737, Hope Health Systems. We're here in the state of Maryland. I say the state of Maryland because we have sites throughout various counties in the state of Maryland. So we'll be happy to service you. Be our pleasure to be able to help you through this time of need.
Actually, that's a great way to wrap up. And I just want to get to a few people. Tamika said mental health is serious, and a lot of people don't take it serious enough. You're absolutely right. Dr. Shepard and I see that on a daily basis. And Candy, just for confirmation of your email, is that JSHEP 2471@gmail.com. Candy,
Yes,
that
sir.
is correct. So if you need to reach out to Dr. Shepard or anybody else for that matter, certainly you have his contact information. And before we go, I just want to say a big shout out to one of my sponsors for the Rashad Mills Show, JetTees.com. They handle all my screen printing and embroidery needs. As you can see here, running with Rashad, as many of you know, I do a lot of long distance running in the community. So if you need to get in contact with them, order JetTees.com. Again, order JetTees.com. And the number is area code 410-685-3730. So you can contact them there. You guys know where to reach me. Facebook, Instagram, and YouTube. Rashad Bowtie Mills. Catch my motivational piece every Friday called Happy Hour. I'm bringing it to you every single Friday. I'm going to give you all the motivation you need. My website, RashadMills.com, if you're in need of a motivational speaker. I'm not just going to show up. I'm going to show out and give you everything that I have in my tank. And then RashadMills.com/shop. You can get yourself a bow tie. Dr. Shepard is doing a fabulous job of modeling one. And again, thank you for supporting what I'm doing as well. So again, thank you so much for joining us on the Rashad Mills Show, PowerPurposeRadio.com. I'll be back here Tuesday night at 8 p.m. with another amazing guest that will educate you guys. So you have Dr. Shepard's contact information. If you know or need of his services, please reach out because mental health is a very real issue. And with that being said, thank you so much for tuning in. You guys have a wonderful night. Appreciate it.
Cool, man.
Yes. Virginia Stern, I haven't seen you in quite some time. Larry Boyd, my man. And then